started offering about 10 years ago as an option for patients because so many women come in and say, well, I don't want to get my breasts squeezed and radiated, and many people have a really uncomfortable process with breast imaging. And the cognitive thing is, well, why am I radiating my breasts every year when the number one cause of all cancers is radiation? So we started looking, and I give my wife the credit. She's like, I don't want to keep radiating my breasts every year. And we found the thermal breast imaging. Thermal breast imaging is a different paradigm. It's different than any other imaging. All other imaging is putting the energy into the tissue to get an image, an X-ray, an MRI, an ultrasound. All of that's penetrating energy. And it gives you an image of the tissue underneath. The thermal breast, while we get an image to see, is not imaging of the tissue, it's imaging of what's projecting off of the tissue. It's a functional imaging. It gives a presentation of the temperature of the surface of the body. Now, we started it using it for breast tissue because of that specific need, but you can use it anywhere. And if you went and you did some, workout with your upper body, or just did the right side and then did a thermal imaging, you'd see there's more heat here. If you scratched your arm and did both arms, you'd see, well, there's a big red mark where the scratch is. If you had a pimple on your arm, or that would show up as well. So all the things that the thermal shows is functional. If there's not enough function there, then that'll show as a cool area. One of the things that incidentally shows up on some men and women's chest is that there's a cool area around the heart. Well, that's a possible sign of not enough blood flow, which is represented on the surface. So the thermal breast imaging, people come in and say, well, I want this test. And what I tell them is, it's a snapshot. The temperature of the breast is like a fingerprint. It's typically the same over years and years. It maybe changes a little bit from wear and tear and aging. It changes with pregnancy. It changes with menstruation. It changes with menopause. But if we get a period of time where we checked it again and see that there's no change, well, that's the best baseline. So we typically recommend a baseline, something 90 days later or so, and then within 6 months after that. After the 3 baseline within the first year, then we do it yearly. If there's an abnormality, if there's an asymmetry, depending on how it shows up, if it shows up every time, well, that's not an issue. If it's something showed up suddenly, well, what's going on? And so we ask questions. Sometimes we do a mammogram then, sometimes we send to a breast specialist for an ultrasound, but if there's no changes over time, the thermogram basically avoids the necessary intervention of getting a mammogram if there's no change. The mammogram visualizes the tissue. If a mammogram's positive, there's a tumor there. There's a calcification. There's something already there. Cancers grow for 3, 5, 7, maybe 10 years. The thermogram may show something. You do a mammogram, it's not there. It's just cellular energy and a temperature, and so we can watch that over time, but it's much more predictive, and things can show up years before a cancer shows up, so we can take appropriate steps. Breast thermogram imaging is not a substitute for mammogram. It is a different type of image. It's a functional image. In many cases, if the functional image is stable, well, then we don't necessarily need to do a mammogram if there's no change. If there's ain't broke, don't fix it. But it is not a replacement. The standard of care is to get a self-breast exam and to do a mammogram. But we like to give options and natural options for women to have a choice, saying, hey, it's not the only game out there, and you can try something different that's not compressive and not painful and no radiation. If something shows, we do the standard of care. I'm not going to tell someone, well, it looks iffy, but keep doing the thermogram. We're going to go right to a mammogram. So for physicians that are having patients that don't want to do a mammogram for whatever reason, this is something to do to say, well, here's another kind of a cursory screening. And if it shows something, well, anyone that I've shown a thermogram being positive or asymmetry generally gets the mammogram because there's something possibly dangerous there. And I am agreeable to those patients to continue to monitor if there's no change over time. But they all have to understand that the standard of care is a mammogram. We want women to understand that breast health is part of a total body health, and we treat the body the mind, and the spirit all at once. And sometimes that's educational, just understanding what the risks are. And the pink ribbons, and there's a lot of marketing and production with October about supporting women. 1 in 8 women now will get breast cancer in their lifetime. That's incredible. With that many people showing up, it's multifactorial, and everyone knows someone that has breast cancer. And so the Susan Komen race is in October, and it's Breast Cancer Awareness Month, and we want to support the ongoing health of the whole body, including the breasts. And so we promote thermal breast imaging, which is a functional imaging that shows the temperature of the breast on the surface, which is predictive of the underlying breast function. Why can't I just do one? Because that's not what it is. It's a series. And some people have had 3 from another doctor, so we'll just do one. But then I got to compare it. So really, once I have a second one, I have much more information. And then the third one, then I go yearly. Yeah, so it's a point in time and a bit of information. And we need 2 points to connect the dots and 3 points to create a graph, a trend. And so that's what we're doing. We're looking at if there's any trend or if there's not a trend. So the timing of the baseline 90 days and 6 months is basically seeing if there's any trend going on in time. If we find someone at their baseline and there's something that's suspicious from the start, I may not wait for the trend. If I'm concerned about it, that patient may need to go in for ultrasound or mammogram right away because there's something suspicious going on. We use the thermogram for other body parts for musculoskeletal injuries. If someone has back pain or neck or shoulder pain and they can't figure out why, it's not showing up on imaging, we could take a thermal image and represent where the dermatome and neurotome is, and it shows, oh, well, look, this follows this pattern, or no, it's just around the joint. So it is a tool that shows us what's going on or maybe where it's coming from. If someone has a radiating pain, there's a pattern of temperature that's controlled by that nerve from their neck or their back that will show on the thermogram. So for injuries or for accident care where there's lawyers and judges involved, this is another way to document injury that maybe doesn't show up any other way.